Here we'll talk about Fournier's gangrene, but before going further, you have to do few things. One is share and subscribe and comment down if you want any more videos or you want me to improve in any way, right? Coming back to this topic, Fournier's gangrene, it is a really bad condition. That's all you have to remember here. It's a really messed up condition where you can see necrotizing fasciitis of perineal region. What do you mean by perineal region? It is an external genitalia, right? The etiology is also very common, like very minor etiology, where you can see this trivial trauma, diabetes mellitus, immunocompromised people, malnourished people, anaerobic and aerobic bacteria. So the organisms involved are Streptococcus, Staphylococcus, Clostridium. So what happens? Let us see the pathogenesis. So this organisms, it will invade the body. So organisms invasion. After invading, it will cause a development of pimple, right? So there will be a small pimple because of the Streptococcus, Staphylococcus or the Clostridium. So what happens after the pimple? There will be aggressive, rapid inflammation of skin and subcutaneous tissue. This inflammation, this rapid inflammation is also called as fulminating inflammation. This Fournier's gangrene, necrotizing fasciitis, fulminating inflammation. So what happens after this fulminating inflammation? It will cause obliteration of the arterioles. So what do you mean by obliteration of arterioles? There will be decreased blood supply to the scrotal skin. What happens if there is decreased blood supply to the scrotal skin? The scrotal skin will undergo gangrene, right? So there will be cutaneous scrotal gangrene. So that is what is happening in the pathogenesis. So what happens once there is gangrene? It will be eventually removed off, right? There will be sloughing off of the skin. So that is what will be happening in the Fournier's gangrene. So if we look at the clinical features, it will be fever because of the infection, pain, it is a severely painful condition, swelling you can see in the scrotal area, crepitus also you can feel because of the involvement of Clostridium or some other organisms, and foul smelling, it's a really foul smelling condition, shock and sepsis, it's a really severe condition. That's why you have to remember shock and sepsis also. So it is a fast spreading cellulitis. If it is involving the abdominal wall, we have some other name. It is called as Melanese gangrene. This fast spreading cellulitis is extending up to the perineal area or the external genitalia. It is known as Fournier's gangrene. If it is going further and extending up to the abdominal wall, it is given as some other name which is called as Melanese gangrene, right? So this is Fournier's gangrene is an extensive gangrene of the scrotum. So eventually there will be sloughing off of the skin and the testicles are exposed. So what will we do in the treatment? It is a surgical emergency. Testes and urethra are spared because of its dual blood supply. Here the skin over the testis, that is the scrotum, is sloughing off. The scrotum is completely dead, gangrenous, will remove it. But the testis is spared because of its dual blood supplies. It is very important point to note down, right? Testis, urethra are spared. So there is no impotence. But the skin over the testis will be lost. So we'll have to do a skin graft to this patients, right? So we can do IV fluid resuscitation for the shock. IV antibiotics can be given because of the infection and blood transfusion can be done. Urgent, wide, aggressive debridement, that is removal of the dead and the infectious tissue should be done, right? After removal, what will you do? You will do dressing, which is called as vacuum assisted dressing. After the dressing, what will you do? You will place a skin graft over the testicles. So this is the treatment for it. If we summarize this whole thing, this Fournier's gangrene is a necrotizing fasciitis of perineal region, right? It involves aerobic and anaerobic bacteria like Streptococcus, Staphylococcus, Clostridium, immunocompromised and diabetic mellitus, trivial trauma, you can see in these conditions. So what is the pathogenesis? All these organisms will invade, it will cause a pimple, then it will cause rapid inflammation which is known as fulminating inflammation, right? So necrotizing fasciitis, Fournier's gangrene, fulminating inflammation. So what happens after the inflammation? There will be decreased blood supply which is called as obliteration of the arterioles through the scrotal skin. So what happens if there is decreased blood supply to the scrotal skin? So there will be gangrene formation and the sloughing off of the scrotal skin, right? So you'll see pain, fever, swelling, crepitus, foul smelling, shock and sepsis. For shock, what will you do? You'll give IV fluids resuscitation, and for fever what will you do? You'll give antibiotics and antipyretics. For pain you can give analgesics, and for swelling, so the swelling is causing this gangrene of the scrotum, right? And also the skin over the scrotum is being sloughed off. So what will you do? You will remove the skin by active aggressive debridement and then you'll do vacuum assisted dressing. After the dressing, what will you do? You will place a graft. So that is what is done for this Fournier's gangrene. So it is a fast spreading cellulitis. If it is involving the abdominal wall, it is called as Melanese gangrene. It's an important point to remember. Testis and urethra are spared because of its dual blood supply, but the skin over the testis, the skin of the scrotum is removed by aggressive debridement, which is followed by vacuum assisted dressing and the skin graft to cover the testicles. So in the picture you can see the Streptococcus staphylococcus of the Clostridium will invade and cause rapid inflammation, which causes gangrene, and eventually there will be sloughing off of the scrotum skin because of the gangrene. And also you can see the exposed testis, right? But here the testis are spayed because of its dual blood supply. So you can see the swollen genitalia, dead black skin, which we should remove it, and we'll have to do this dressing, and afterwards we'll place a skin graft. So this is about it. Bye.